Hi guys, Heather here. Hope everyone had a Merry Christmas. So are any of you ever sitting in report and you realize that 3 out of your 4 patients or 4 patients all have blood sugar checks and you're thinking to yourself, ugh, now I have to check everybody's blood sugar before meals and possibly give them insulin if their sugars are high. My day's gonna be busier for sure. Come on, we've all thought that, right? Okay, so maybe it's just me, but after I get a report, I'm like running into my patient's room, trying to check their blood sugars before they start eating, because some of those patients, they like to eat early, and I can't really blame them. But sometimes I get stuck in another room, somebody needs to go to the bathroom, or somebody needs pain meds, and then I have a patient in another room eating his breakfast, and I haven't even checked his blood sugar yet. So, what do I do then? Well, it's supposed to be a fasting blood sugar. But if the patient just started eating, I'll go ahead and check it because it takes a little time for the glucose to absorb into the bloodstream anyways. And some patients are really good about telling you when they've ordered breakfast so you can check their sugar, and some just don't care. They'll be like halfway done eating or finished eating as you're running in there with your blood glucose machine. And then the patient says, oh, I forgot. And you're like, sure, you've been diabetic for how long? Just admit it, you didn't want to be pricked. But I'm gonna prick you anyways, haha. But I can't really blame him because I always hate annual glucose competencies where we have to prick each other. It's not cool. But you know what? Actually, some patients don't prick themselves like before every meal. Okay, everyone, turn to page 212 in your med-surg book. The fasting blood sugar of a non-diabetic patient should be around 70 to 110. But a lot of patients that come into the hospital have higher sugars because the sugar goes up when the body's under stress. So a patient that just had surgery and they're sick and they're on steroids might have sugars in the 200-300, sometimes even higher. So the doctor will put them on like a mealtime short-acting insulin, a longer-acting insulin, anything to try and keep that sugar like less than 150, maybe around 140, because that's when we start giving insulin in the hospital. Some patients' sugars are skyrocket out of control, but we do our best to control them while they're in the hospital. Well guys, thanks for watching. Talk to you later, okay? Bye!